I despise the US healthcare system, and no one understands why it's so terrible, except for the fact that it's not for the consumers, is it? It's for insurance companies and pharmaceutical companies. That's what it's there for. But what's more important, what is the best healthcare system? What experts say about who has the world's best healthcare system? This is an opinion piece, of course, from Washington Post. We don't really like them, but whatever. Let's hear it.
I want to start with a simple question. Which country in the world has the best healthcare system?
Yeah, so I hate that question. Here's where you should ask me why I hate that question.
I knew you were going to start with that question.
Of
I think
course.
it's a question that a lot of people ask. Which country has the best healthcare system? And
I don't think there's a correct answer to it.
It depends on what it is that we value.
I'll give you.
I mean, I get it. You can't just answer that you can't put an absolute to it. Every country is different. They have different population sizes and all, and they need to be a bit different. But we can definitely agree the US is terrible.
You an answer, but then I'll tell you why the answer might not be applicable. If you look at the World Health Rankings, the country that came out on top is France.
Yeah.
I think in general, starting from France and working northern, you tend to get the best healthcare systems. But the reason why it's not entirely applicable is that what works in one country may not work in another country.
So a number of years ago, just a few years ago, I wrote a piece in the New York Times with my colleague Aaron Carroll. We actually did a tournament of health systems. It was like a bracket tournament, the way March Madness is a bracket tournament, or like a tennis tournament. And we had me and Aaron, Uwe Reinhardt, Ashish Jha, physician, now Dean of Brown, and Craig Garthwaite, an economist at Northwestern. And we each voted in each of the brackets, like in each of the pairings, for which system we liked better. And then we ultimately got a winner. But one of the important takeaways from that whole process is that in no pairing did any country win 5-0. There were 5 of us, right? We were not unanimous in any decision. There was always at least someone who disagreed, and in many cases it was 3-2. And we each had different reasons. You know, someone was very big on the cost, equity, access, or the quality. And so to me, look, this is 5 people who know healthcare pretty well and know these systems pretty well, and we couldn't even agree. So there's just no clear winner, actually.
But the one thing that stands out is that among all major developed nations, it's pretty clear that the United States comes in dead last.
Yeah.
On the other hand, I think everyone, especially experts, should be skeptical that they know the answer. Because what works in one country or one setting doesn't necessarily work in another.
Okay, that's true. But again, we can agree that the US is terrible, right? And you can see that in the response everyone had to what Luigi Mangione did. No one was angry about it, really. Let's be honest.
There are aspects of the Australian system I like. There are aspects of the English system I like. But I don't think that there's a system we could just bring over here and install, like a new fridge.
So maybe the better question is, what would the best system for the US look like?
Yes.
And what would that look like?
She's like, damn, I didn't think I was going to be asked that. That's what her face looked like. She's like, oh, don't ask me that.
So a good healthcare system, or let's just call it a healthcare system. A good healthcare system has, I think, to me, several attributes. One is,
how does it affect our health as a country?
How long is it that people are living? What is the infant mortality rate? What is the rate of certain types of diseases, and how well are they doing in prevention?
And the second question I'd want to know the answer to is, were the benefits of the treatment greater than the cost of the treatment?
A bad healthcare system?
Yo, that is such a crazy statement to make. Were the benefits of the treatment greater than the cost of the treatment? Almost like money is more important than the human life, right? Or a treatment. I understand it needs to make sense, it needs to be sustainable, but goddamn, you can't just frame shit like that, man. That is so dystopian.
Could have overspending on care that's of really questionable health benefit at the same time that it has underspending on healthcare that's of vital importance to people. So when people say, do we spend too much on healthcare? We spend way too much on some things and way too little on others. So a good system would fix both problems.
And the third dimension for healthcare system is how well does it reflect our values as a society?
And by values, I mean, what are the rich willing to do for the poor? What are the healthy willing to do for the sick? The answer to that doesn't come from economics. It's an answer that we all have within us. But that answer profoundly affects how you answer questions about what's good and bad about healthcare.
And I would hope that going forward.
Man, the way these guys are forming these things is like, man, brother, it's not that complicated. It doesn't have to be this complicated. We're not trying to solve philosophical questions in the world, okay? I understand Americans like privatization, I get it, okay? That's just what you're trying to say here. But damn, like right now, the country or the average person spends way more on healthcare through the stupid system that exists, which is being subsidized by lobbying powers and everything to keep it going and keep it as bad as it is. And we're wondering whether it would align with the mindset of Americans. I get it. Americans need to want it, but at the same time, it's like, it's just a lot of fluff. It's just a lot of fluff, man.
As we think about the learnings from other countries, we can take a hard look at what it is that we have and whether they align with our core principles that we otherwise hold so dear.
Sure.
So my goal is have a health system that does the most it can to improve our health, that protects people from financial ruin, and that conforms to our values as a society.
So,
I mean, it's a very straightforward 3 pieces.
Yeah, that would be the right thing to do in principle. That the next question should be like, can we get there from here?
Man, it's really the U.S., at least one of the only developed countries, if not the only developed country that even needs to have a conversation like this.
And I just don't see it.
What we've seen over time is that the costs of healthcare have gone up, but outcomes have also improved. So if we take some measure, and the measure that I like to use is life expectancy at age 40, and then I look on the other axis at the cost of healthcare per person. And what you find is, if you look back to 1976,
all of these countries, the US, Germany, Canada, look similar in terms of what share of GDP goes to healthcare.
And they are all people are living about 35 years after age 40. Okay.
Fast forward 20 years, and the US is spending a lot more of its GDP on healthcare, and its life expectancy increases have not kept up with the life expectancy increases in other countries.
So the US becomes increasingly an outlier, both in terms of outcomes, that is life expectancy, and in terms of spending.
Now, you can put the two on the same graph, but that doesn't mean that they're related in any way. I think we're simplifying the other healthcare system to the point of getting it totally wrong. But a lot of it depends on who you're talking to, right? I think there's a view that some Americans have that in other systems care is terrible. You know, there's very long waiting lines and waiting lists, that the latest medical technologies are routinely not available. I think for a lot of other Americans, there's this view that other countries have just figured it out. And what we should be doing in the United States is copying what they've already figured out. And I think both those views are not right at all.
So I think people mix up this term called socialized medicine with what I would call universal health care.
One is the insurance part, that is who runs the insurance, and you can have socialized insurance where the government is running the insurance, or private insurance where private companies, or both. And then second, there's the providers of medical care, who could be either government-run employees or private employees.
There are some methods that one could classify as being socialized medicine, meaning that the government is a single payer, the government operates all the healthcare, and people belong to a single government system.
So Britain has socialized medicine because the hospitals are government institutions and the physicians and nurses are government employees.
And France has yet a different kind of a system, also not not government owned. In Switzerland, Netherlands, Germany, these are places that have universal health insurance, but they have active and important private health insurance companies that administer it. So very different structures of these systems. The thing that they share in common is that they're universal.
So I think, coming full circle, my great worry with healthcare reform in America is that it has collapsed to the level of kind of fighting and arguing about these slogans. And the slogans have nothing real behind them.
These slogans
I agree with that wholeheartedly. Everyone's trying to come up with a solution with no solution.
become so politically charged and tied to a particular candidate or a particular viewpoint that has become completely partisan and will shut down constructive debate.
And if you go back to what I was talking about, how do you evaluate a good healthcare system? You don't evaluate it by the share of government in the system. You evaluate it by whether patients want the care that they get and whether the care that patients get is worth it. I think that other countries have great hospitals, cover a lot of medical treatments, have fantastic doctors, and at the same time, they have not figured out a bunch of things that we have not figured out. So if you are the kind of person who's going without health insurance in the United States,
I hate to say it, but I think they are better off in many other countries than here in the US.
But for a lot of diseases, for a lot of people, regardless of income, this is probably the country where you would like to get your health care.
Bro, if you have the money, sure, perhaps, but I don't know, man. So I don't know why he would make such a statement. It just sounds incredibly ignorant. That's what it sounds like. And I get it. Some public systems in, for example, Europe, can have their own issues. I agree. And there is a lot of technological advancement in the US in terms of healthcare and maybe a bit more freedom as well as to what you choose. I'm not sure. But it's just with the US being so shit at healthcare, making a statement like that is incredibly difficult to hear. You could say that if it were better. In my opinion, anything you do at this point is going to be better than what you currently have. That's what it feels like, right? But I'm no expert. I could be wrong. Let's hear the end. No? Well, that's the end. So, Democracy Dies in Darkness. Yeah, what a title. All right, so let's hear it because I think a lot of people would disagree with that end statement. A lot of people. Australian here. Wife had AAA, but I guess that's bypass, sorry. 3 hospitals in 24 hours, flown out, mid-operation, blah, blah, and it's going to be $0, right? Where's the $0 attack? Parking is the main cost. There you go. Remember a Reddit somewhere where a particular person that attended a healthcare symposium, the speaker had said, paraphrasing, America healthcare system works exactly as it's intended. It's just not intended for the benefits of the patient. That's correct. That's what it feels like. In fact, just looking through all the documentation of when you choose healthcare is a pain in the ass. It's too complicated. Too many copays and I don't know, whatever, man. I just had open heart surgery. The most difficult part of the whole process from diagnosis to recovery was fighting off the insurance company. Yeah, this is the USA healthcare system. Only one day after surgery, I start getting notices that my insurance will not pay. Wow, man, imagine that. They even sent a rep to the ICUs to tell anyone who would listen. They eventually did pay, but it was a tough battle that left me feeling beat down. Imagine you're trying to recover from some of the most difficult surgeries in the world, right? And someone comes and tells you, hey, you're going to be medically bankrupt after you're done here. It's like, you start wondering, I should just die then, shouldn't I? I had a heart attack in New Zealand at 5 p.m. 2 stents were installed by 8 p.m. The only cost, the parking fee for my wife visiting me. Universal healthcare is great. By the way, the Australian healthcare thing here, I've been looking into it. Apparently, they're having some issues now in terms of bulk billing where the whole fee was supposed to be covered, but not anymore. In terms of doctor visits, at least, I'm not sure. Some Australians out there that can elaborate because it's not a good development if that's the case. I don't like hearing that. As an attorney who has worked a lot of healthcare cases for hospitals, insurance providers, and pharmacies, I can tell you that our system is deeply and profoundly broken. I do not know how to fix it, but something needs to change and soon. Yeah, exactly. A lot of people feel like this. And we personally might not know the answer, but it's become so common that this is just what it is, right? And it's terrible. Many Americans seem unaware that much of the EU, as well as having universal healthcare available to all, you can also choose private healthcare. That's correct. Since there are plenty of private hospitals, you can pay off your own pocket. Yeah, and I know Americans are into that, private, right? I get it. I also want to say, don't forget, universal healthcare or free healthcare, as they say, is not free. You pay in taxes. You do. And if you're not a taxpayer, yes, it's technically free for you, paid by other people. But it's some sense that when you live in a country with other people, let's have some form of unity, right? At least in the fact that we want to keep each other alive. If you saw someone dying in front of you or in an accident or whatever, likely you're going to get out and try to help them, just based on empathy. But they don't want to hear it when it comes to some form of universal idea. And I agree, maybe those ideas are not the ones for the US, but finding out something that's better than what it is now, oh man, it's just like way overdue. As a Norwegian who cares a lot about healthcare and have lived in the US and the Netherlands and experienced the healthcare there was well, I think the interview here echo a lot of my own experience and views, even if I think you miss a lot by just listening to a bunch of experts in America who have never actually lived abroad and experience these systems for themselves. Okay, let's hear it. Let's hear it, man. Let's go. Let's go over this. Will be the last one, because this is actually a really good comment. Because when I was listening to the video as well, it's just like it's a bit whatever. It is true, like these guys say, that nobody has figured out everything. That's correct. We all struggle with healthcare systems in every country. That's also correct. In fact, everyone is often so frustrated with their own system that we may not always realize how good it is. I was very negative to the Norwegian system until I lived in the US. But my experience in the US was definitely mixed. Certain things worked very well in the US. 1, often very highly competent doctors. 2, proactive doctors, good at asking pointed questions. 3, emergency response is very good. All right. Problem is cost. The thing is, people aren't necessarily, there might be arguments, but people aren't necessarily arguing about the quality of healthcare in the US, but rather the fact that you can't even access it. So when he says at the end of the video, you'd probably want to be in the US if you need healthcare, doesn't work if you can't even afford the healthcare. Otherwise, I would agree. Here's what I found clearly bad in the US system. 1, zero holistic thinking. Healthcare is like a product you buy off the shelf like any other consumer good. Yeah, very influenced by pharmacy. There isn't much of an attempt at raising general health in the population. In many other European countries, one starts much earlier, focusing on how people eat, teaching nutrition, getting kids to have health habits, etc. In the US, this aspect seems to be entirely lacking. Yes, I think ads need to get off the TV, and I agree with this. Healthcare should be seen as a lifelong goal, right? And in the US, you come in, you get a quick fix, and you continue. It's very convenience-based, which is a very American thing, convenience. 2, you are a customer more than a patient. They often focus more on making you satisfied with the service rather than doing what is best for you as a patient. Yeah. Overtreatment is a clear problem. They give way too much painkiller and antibiotics, for instance. Yeah. Well, yeah. You get pills which serves no purpose for your condition, just in case. This sometimes I might see in a place like Denmark, where there's a lot of overtreatment of painkillers for anything. You have a small headache, painkiller. Too much, man. 3, very focused on pills and procedures rather than lifestyle changes and health advice. Instead of a system which lets people who are not well take some days off to recover, humans are treated like broken machines which need a quick patch up with pills and surgery. That's what I was saying, right? Americans who are not well are constantly pushing themselves to work, popping pills instead of being given time to recover naturally. I also know that taking PTO or paid time off or any form of leaving work for a bit is not seen as a positive thing in the US. I know my wife works in a US company. I'm not going to mention which one because it's irrelevant. It's actually the people in it. It's actually the mindset itself, not the company, where I think it's like a multinational company, right? And this company also has a section in France. And in France, people were taken off for vacation or sick days or whatever, and Americans would scoff at it. So, they're taking vacation again. And it's like, bro, do you like having a hard time? You like being sadistic to yourself? Like, what the hell is this? Sadistic, I don't know if that's the right word, but 4. But it's just weird. It's just weird. What a weird mindset. Like, they're taking time off for vacation. Fucking hell, man, go for it. That's amazing. I don't get it. Well, maybe because I'm European, I guess. 4, excessive pill commercials everywhere. I agree. Get that shit out of here. Giving people the idea that everything is just about getting the right pill. This is a general US problem. All problems in the US are presented as being solved by the right consumer product. It's the same like lawyers and all the billboards. Your life improvement is always something for a company to profit from. Very, very good overall idea. Basically, quality can be very good. Emergency response is very good. Well, that's because you pay for it, right? And these things, is just a theory, these things might go down a bit if the whole thing was socialized. And so I get the Americans' disturbance with this. It's just a theory. I know that that's not the case for other countries in Europe where they still have very good emergency response, etc. But overall, if this were to be decreased by even just 10%, right, these 3 points, but you have access for everyone, I don't know, man, that's a pretty good solution. And you can go private if you want and get the higher quality. That gives the ability to do, I don't know. What do you think, man? Should the US continue in its way right now? It'd be weird if you say yes, at least give us your reasoning, right? Should it adopt another country system? Should it build its own? Should it change it? What should it do? Tired of people dying for no damn reason. Yeah? And tired of people getting declined by health insurances for needs that are clearly needed. It's annoying, and I hate seeing it because I like humanity, and I like my fellow man and woman. I do, and I don't want to see them having a hard time. Of course, some is self-inflicted, let's get real, some is self-inflicted, but in many cases, when you come into an accident, you get into a car crash, fall on your bike, break your arm, whatever the case may be, I'd like to pay some tax for you to have an easier time out of that. I don't mind that. But maybe that's just me and my bias. So what's your bias? Let me know.